I'm Jenny Parnell. I'm a nurse practitioner student at Maryville University. This is my head-to-toe assessment. This is Ryan. He has volunteered to be my patient for this exam. Before we began, I had the patient empty his bladder. I had him slip on this gown. I took his vital signs, his height and weight. I took note of his vision using the Rosenbaum chart for near vision and the distance chart using the Snellen chart. I took note of his general appearance and his gait as he entered the room. I have washed my hands and I am now ready to begin the exam. So first we will start by doing just a general inspection of the skin. The skin is warm, it's dry, there's no lesions, the turgor is good, there's good cap refill. I'm just looking to make sure that there's not any open sores or rashes, and there doesn't appear to be any. And as we move through each system, I will be testing the skin in those systems as well. So now we'll move on to the head. I'm looking at the head. It's normocephalic. I'm going to palpate the scalp for any lesions or tenderness. Ryan, do you feel any tenderness there?
No.
And the scalp moves freely when I do this. The hair is equally distributed. There's no signs of alopecia or excessive dryness. Now we'll move on to your face. The face is symmetrical. There doesn't appear to be any bruising or lesions, and his facial hair is evenly distributed there as well. So now we're going to do just a few things to test cranial nerve 5. Ryan, I'm going to have you tell me if this is sharp or dull. This is dull, and I'm sorry, this is sharp and this is dull. So now with your eyes closed, just tell me if it's sharp or dull.
Sharp. Dull. Dull. Dull.
Okay. And now with your eyes closed, just tell me where I'm touching you.
Forehead. Left cheek. Nose. Chin.
Okay. And now what we're going to do is I'm going to have him follow just a few commands for me. So Ryan, if you could please wrinkle your forehead. Close your eyes shut tight. Smile. Frown. Puff out your cheeks. Stick out your tongue. Terrific. Now I'm going to test his sinuses to make sure there's no tenderness. So first we're going to do the frontal. Ryan, do you have any tenderness?
No.
Any tenderness in your maxillary?
No.
And now we'll move on to the temporomandibular joint. So open and close your mouth for me. And close. And open. And close. Any tenderness there?
No.
And I didn't feel any clicking or rubbing there either. So now we'll move on to the eyes. So the eyebrows extend out to the outer canvas of the eyes. The eyelashes flip up. There's no drainage, no excessive tears or dryness. I'm gonna pull down the conjunctiva. I'm looking at it to make sure it's pink. The sclera is white. There's no signs of jaundice. The irises are both round and equal. I'm going to have you close your eyes. I'm just palpating for any tenderness. Any tenderness when I do that?
No.
And I don't feel any nodules or anything extra there either. So now we're going to test Ryan's vision. So what we're going to do here is, I'm sorry, we're not going to test his vision. We're going to test his pupillar reflex. So now what we're going to do here is I'm going to test direct and consensual and direct and consensual. And I'm just making sure that his pupils constrict when the light hits them. Now what we're going to do is I'm going to have you do the cover and uncover test. If you could please close your left, or cover your left eye with your left hand. Focus on my stethoscope here and uncover. And I'm testing for accommodation to make sure there's no nystagmus or strabismus, which there is none. And go ahead and do the opposite eye. And uncover. Terrific. So again, no nystagmus or strabismus noted. So now we're going to do Ryan's 6 cardinal fields of gaze. So Ryan, with your eyes, not your head, follow my pen line. Terrific. And I didn't see any nystagmus, strabismus, so that means that cranial nerves 3, 4, and 6 are both intact. So now we'll move on to the ears. With the ears, they are symmetrical with the eyes. They are not low set. I don't see any outside lesions, any sores, anything extra noted there. So, Brian, I'm going to tug on your ear and tell me if you have any tenderness.
None.
going to test Ryan's acoustic nerve. So Ryan, if you could cover your left ear for me. I'm going to say a series of numbers and letters. Just please tell me what I said.
390.
Okay, and now let's try your right ear.
RY8.
Okay, so the left ear is intact as well as the right, so that means that the acoustic nerve is intact. Now we're going to do the Weber and Ryan test. So Ryan, I'm going to strike this tuning fork. I'm going to place it on your head. Please tell me in what ear, if both, you hear this, okay?
Both ears the same.
Okay, and now we're going to move on to the Ryan test. We're testing for sensory neural hearing. So I'm going to strike it here. We're testing for bone conduction. So please just tell me when it stops.
There.
Okay, and again, tell me when it stops.
Right there.
Okay, so air conduction was twice as long as bone conduction, and that's what we want. So we're going to move on to the opposite ear. Strike my tuning fork, place it on the mastoid bone for bone conduction. Just tell me when it stops.
Right there.
And we're going to do air conduction and just tell me when that stops.
Right there.
Okay, so those are both intact. Now we're going to go ahead and look in your ears. We're going to check your ear canals and your tympanic membrane. So there's no extra serum noted. The tympanic membrane is intact. There's no bulging. There's good cone of light. It's pearly gray. All bony promises are visible. Now we're going to move on and do the opposite ear. Again, there's no extra serum. There's no there's not a lot of earwax. There's no tympanic membrane's intact. There's no bulging erythema. There's good cone of light. It's pearly gray, and all bony promises are visible. So now we're going to move on to the nose. So I'm just looking at Ryan's nose. It is symmetrical and intact. It's midline. There's no bruising or trauma around the eyes. Ryan, if you could cover your left nostril and take a deep breath in and out. And we're going to move to the other nostril. In and out. Any trouble when you did that?
No.
Okay, good. So that means our olfactory nerve's intact. Now what we're going to do is we're just going to take a look up Ryan's nose to make sure that the septum is midline intact and the turbinates are clear. And it is. The turbinates are clear and the septum appears to be midline. Now what we're going to do is we're going to move to the mouth and the pharynx. So just looking at the outside of the mouth, there's the lips are pink, they're moist, they're intact. There's no excessive dryness. I don't see any lesions or sores on the lips or the mouth. So Ryan, if you could please open your mouth for me. I'm just looking at the hard and the soft palate. They're intact. I'm looking at his teeth. I'm noting the color is white. They're equal in number. There's no broken or missing teeth. He's got a few fillings, but they appear intact. Ryan, if you could say ah for me. The uvula raised midline, when Ryan did that, the tonsils were 2+, there was no erythema. Now Ryan, if you could please stick out your tongue for me and move it side to side and up and down. Okay, and I was checking for any signs of oral cancer there. Now what we're going to do is we're going to test Ryan's gag reflex. Okay, and the gag reflex was intact. So now what we're going to do is we're going to move on to the neck. I'm just taking note of general appearance of the neck. It appears supple. I don't see any jugular venous distension, any masses that I can see. We're going to move on to the carotids. We're going to assess them one at a time. And they're 2+. Now, what we're going to do is I'm going to go behind Ryan and we're going to have him drink this water. We're going to assess the thyroid. So I'm going to displace it with my left, feel it with my right. Ryan, take a sip of water for me. Terrific. I felt the thyroid, but I didn't feel any goiters or, the thyroid did not feel enlarged to Now while we're on the neck, I'm going to go ahead and auscultate the carotid and the thyroid just because we're there, and I'm going to do it with the bell of my stethoscope. And what I was doing, I was just making sure that there were no bruits or thrills noted there, which there were not. Now I'm going to assess Ryan's lymph nodes. So first we're going to do the pre-auricular, the post-auricular, the occipital, the submandibular, sublingual, submental, superficial anterior cervical chain, superficial posterior cervical chain, deep cervical chain, epitrochial, just making sure we don't feel any Virchow's nodes, which would suggest malignancy, and we don't. Now we're going to do the axillary. So raise out your arm for me. Okay, and the epitrochial. And there was no lymphedema or lymphadenopathy felt. And I did that with the pads of my second, third, and fourth fingers. Now what we're going to do is, since we're on the neck, is we're going to have Ryan do some range of motion exercises. First, I'm going to have Ryan turn his head towards my hand. And opposite. And please shrug your shoulders. So what we're doing there is we're testing the spinal accessory to make sure that those nerves are intact. Now what we're going to do, Ryan, we're going to test some range of motion to make sure there's not any tenderness. So Ryan, if you could please put your chin to your chest and look up. And now side to side. Ear to shoulder. Ear to shoulder. Any pain felt there?
No.
Okay, terrific. Okay, so now we'll move on to the back. And we're going to look at the posterior chest as well as the back. If you wouldn't mind flipping around and looking at the wall. Alrighty, so what we're going to do here is I'm just taking, again, in general note of inspection of the skin. It's intact. The chest wall expansion looks symmetrical. There's some scattered nevi throughout, but they're less than 5 millimeters. The borders are even, the color is even, so we're not going to worry about that. So what we're going to do is we're going to palpate down the spine, and we're going to have Ryan tell me if there's any tenderness. Any tenderness when I palpate, Ryan?
No.
Okay, now we're going to test the costovertebral ankle. Any tenderness when I palpated there?
No.
Okay, terrific. Now, Ryan, when you feel me touch you, please take a deep breath in and out. And what I was doing there is I was making sure my thumbs came apart when Ryan inhaled, and they did. So that means that chest wall expansion is symmetrical. So now what we're going to do is, Ryan, when you feel me touch you, say 99.
99, 99, 99, 99.
And we're testing for tactile firmness there. So now what we're going to do is we're going to percuss. I hope to hear resonance over lung sounds and dullness over bony promises like the scapula. And that's what I heard. So there was dullness over the scapula, but good resonance over the lung sounds. Now what we're going to do is we're going to percuss for diaphragmatic excursion. So what we're going to do is we're going to have Ryan take a deep breath in and hold. And I'm percussing down until I no longer hear resonance. And I'm going to mark that with a pin. Now, Ryan, if you could breathe normal. Okay. Now take a deep breath in, but blow it all out and hold your exhale. And I'm percussing back up till I hear that resonance. Okay, I'm going to mark that and just breathe normal. So now we're going to measure it, and we want it to be between 3 to 5 centimeters, which it is. Now, normally we would do it on the opposite side, and we would measure them to make sure they were symmetrical, but for time's sake, we're not going to do that. So while I've got Ryan's back exposed, I'm going to go ahead and auscultate his lung sounds with the diaphragm of my stethoscope. Deep breath in for me, Ryan. And out. Deep breath in. And out. Deep breath in. And out. And deep breath in. And out. And then you please say 99 when you feel me touch you.
99, 99, 99, 99.
Perfect. And that was muffled, and that's what we wanted it to be as well. So now we're going to flip around, and we're going to look at the anterior part of the chest as well as the heart. So right now I'm just going to undo your gown here so we can take a peek. Okay. So what I'm looking at is I'm making sure that his chest rise is equal. There's no use of accessory muscles. There's no there's no labored breathing that I can tell. So now what we're going to do the same thing we did on the back on the front. So Ryan, when you feel me touch you, can you take a deep breath in and out? So I was again looking to make sure that there's good chest wall expansion, making sure that my thumbs came apart equal and symmetrically when you took a deep breath. Now what we're going to do when you feel me touch you, I'm going to have you say 99.
99, 99, 99, 99.
Great, there's good tactile firmness. Now I'm going to listen to the lung sounds on the anterior side. Just take a deep breath in and out. Deep breath in and out. Deep breath in and out. And deep breath in and out. So there was good vesicular lung sounds heard. There weren't any extra sounds such as wheezes or rhonchi. So now since we're on the front side, we're going to move on to the heart. So again, I'm looking at to make sure there's no JVD. I don't see any pulsations noted there. I'm going to go ahead and palpate the point of maximal impulse, which is the fifth midclavicular line. And what I'm doing is I'm palpating to make sure there's not any heaves or thrills or lifts noted, and there's not. So now I'm going to go ahead and listen to Ryan's heart. Ryan, if you could just breathe normal for me. And what I'm doing there is I'm just making sure there's good equal rate rhythm. There's not any murmurs or extra sounds such as gallops heard. Now we're going to move on and we're going to listen to different heart sounds. So first we're going to start with aortic, pulmonic, Erb's point, tricuspid, and mitral. Terrific. And again, that there was S1, S2, and there weren't any murmurs or gallops heard. So now what we're going to do is we're going to have Ryan lay back. Ryan, if you could just keep your belly exposed for me. So I'm just looking at the general appearance of his abdomen. It does not appear to be distended. There's equal chest expansion. The hair is equally distributed. Again, he does not appear to be in any distress in doing this. So what we're going to do is I'm going to have Ryan lift his head off the pillow and back down. And what I was doing there is I was making sure that the abdominal muscles were symmetric, that there weren't any hernias noted. The umbilicus, just looking at it, is midline. So now what we're going to do is we're going to do some percussion. So I'm going to percuss over the organs. And so first we're going to start with the liver. We're going to percuss until from dullness to resonance over the liver. I'm sorry, from resonance to dullness. And I would mark that with a pin, and I want that to be 6 to 12 centimeters, which just kind of measuring, it looks like it is. So now what we're going to do is we're going to palpate, light palpation to deep palpation. Ryan, just tell me if you have any tenderness, okay? This is our light palpation.
No tenderness.
Okay, and then this is our deep palpation.
No, again, no tenderness.
Okay, so now what we're going to do is we're going to palpate for the organs to make sure that there's no organ meglia. First, we're going to start with the liver. And I'm going to palpate just to make sure that the liver borders are clear and equal, and that there's, again, no hepatomegalia. And I feel none. So now we're going to move on to the spleen. The spleen's on the left side. I'm going to palpate to make sure that there's no splenomegalia. And I don't feel any. And now we're going to do the kidneys. Now the kidneys are a little bit harder to feel And typically you won't feel them, which is a good sign. So Ryan, I'm just going to try to palpate your right kidney here. And I don't feel that one. And I don't feel the left one either, so that's perfect. That's what we don't want to feel them. So now what I'm going to do is I'm going to listen to Ryan's different arteries in his belly. So first we're going to start with the abdominal aortic. The renal, left and right. Here's the left. The iliac. And the femoral. Again, I was listening for any bruits or pulsations and I didn't hear any. So now I'm just going to listen for Ryan's vowel sounds in all 4 quadrants. Vowel sounds are present in all 4 quadrants. They're not hypoactive or hyperactive. So while Ryan's laying down, I'm just going to move on to his legs. Ryan, I'm just going to have you slip up your gown and we'll tie it once we get standing, okay? So what we're going to do here is I'm taking note of Ryan's general appearance of the skin on his legs. The hair is evenly distributed, the skin temperature is warm, it's dry. I don't see any edema in his feet or his ankles. I'm going to go ahead and feel the popliteal pulse on both sides. And it's 2+, it's equal in both. It's not bounding and it's not hard to feel, and that's what we want. And we're going to move on to the dorsalis pedis and the posterior tibial. And again, they're 2+, they're equal, they're not bounding or hard to feel. Now while Ryan's still laying down, I'm just going to test his cap refill and his toes. It was less than 3 seconds, and that's what we want. Now Ryan, if you could just sit up for me. I'm going to go ahead and tie your gown so it doesn't fall off. Alrighty. Now we're going to move on to the lower extremities. We're going to test some range of motion in both his upper and lower, but we're going to start with the lower. Okay, so Ryan, what we're going to do is I'm going to have you press on the gas, lift up, okay, and I'm going to have you squeeze my hands, and I'm going to have you put your arms out. Now try to pull against my hands. Terrific. So there's great range of motion throughout his extremities. Now we're going to go ahead and we're going to test his radial pulses, his brachial pulses. And again, they were 2+, they were equal, they weren't bounding or hard to feel. Now we're going to move on and we're going to go ahead and do our reflexes. First, we're going to start with the patellar bilaterally. Ryan, just relax your legs for me. Okay, and now we're going to do the Achilles. And now we're going to do the radialis. That's what we were looking for, that little finger flick. And you could also do the biceps, but for time's sake, we're not going to do that. Now what we're going to do is we're going to have Ryan stand up. And we're going to have Ryan bend over and we're going to have Ryan bend over and touch his toes. And what I'm looking for there is I'm looking for equal spine curvature. There's no lordosis or scoliosis. He is able to bend down and has great range of motion. So now Ryan, go ahead and stand up. Turn around and face camera. What month is it?
April.
Okay, and who's our president?
Barack Obama.
So that would say that Ryan's alert and he's oriented. This concludes our head-to-toe assessment. Thanks for watching.